Welcome to One-on-One. I'm Steve Adubato. It's our pleasure to welcome for the first time Dr. Kevin Yao, who is a neurosurgical oncologist, Englewood Hospital and Medical Center. Good to see you, doctor.
Thanks for having me.
Explain what neurosurgical oncology is.
It's someone like myself who specializes in the surgical treatment of brain and spine cancers and tumors.
Okay. Now, is there something unique, or what is it that is unique about those particular kinds of tumors?
Well, they're tumors that involve the brain and spine, and so typically I treat patients who either have cancers or tumors that start in the brain or spine, or even more commonly, I see and treat patients who have cancers that start somewhere else in the body, and then secondarily, these tumors and cancers can make their way to the brain and spine, and then we try to help patients who have symptoms from those.
You know, I've got to imagine that treatment, that the way you treat these particular cancers has evolved dramatically over the years as the technology and research has expanded, grown.
It has, yes.
One of the areas, and I've seen a lot of literature on this, and I see some promotional pieces talking about TrueBeam radiotherapy.
Mm-hmm. Yes.
I see these huge machines in these ads. Okay, TrueBeam radiotherapy, it's groundbreaking. I'm thinking, okay, what is it? Mm-hmm. What difference does it make to the patient, and why do we need to know about this?
Yeah. Well, I mean, just to give you an example for what I do, traditionally, say, half a century ago, the only way to really deal with a cancer that made its way to the brain, say someone had cancer in the lung that secondarily spread to the brain, the only way to do treatment for that kind of tumor was either what's called whole brain radiation, meaning you basically blanket the whole brain.
The whole brain?
The entire brain, not even just the area that had tumor, but the entire brain with a dose of radiation, hoping that that kind of general treatment would control the tumor.
Hoping,
right. Or a second option would be to do open brain surgery. So you can understand how...
Open brain surgery?
Yes,
For those of us who just hear that expression, but have absolutely no idea what the implications of that really could be, describe open brain surgery, then put in perspective this TrueBeam situation.
Yes. Well, the technique of open brain surgery, or specifically the way we describe it is a craniotomy, meaning actually opening up the skull and then delving into the brain to take out a tumor in the brain. That technique has really evolved a lot over the past, half century to century. But clearly, it's still invasive treatment where a patient has to be admitted, they have to be able to tolerate usually general anesthesia, all the stresses to the heart and lungs of having this major surgery done, as well as, obviously to take out a tumor that's in the brain, particularly if it's deep in the brain, that
Isn't
requires...
there other tissue involved?
Exactly. So that there is some manipulation of normal brain tissue to get at the tumor to take it out.
How has it changed with the TrueBeam operation or the TrueBeam technology?
So with TrueBeam technology, which is a form of radiosurgery, we can actually treat these brain tumors without open surgery, without an inpatient hospital stay, and without any manipulation really of the normal brain.
How?
Essentially what radiosurgery is focused beams of high dose radiation, all focused on the three-dimensional nature of the tumor, meaning all these little beams of radiation essentially cone in on the tumor such that the tumor itself receives a really, really high dose of radiation that essentially kills it. But where all those separate beams sort of go through, all the normal brain tissue essentially receive minimal to no radiation.
And the patient after this procedure, describe the recovery for this patient, doctor, post TrueBeam versus the other kinds of procedures you were talking about.
Yes. So, following an open brain surgery, even in the most smooth...
Give best case scenario.
Yeah, best case scenario, a patient has this surgery done. Within a couple days, they're up and around moving, and so that by, say, like 3 days after the surgery, they're finally going home, but they're going home still with a pretty significant recovery period ahead of them, where they go home and still need to deal with managing the wound and really kind of regaining their strength, which all in all takes at least, I'd say, the next 2 to 4 weeks after open brain surgery. It's very different than radiosurgery. With radiosurgery, this is an outpatient ambulatory procedure, meaning we do all the planning ahead of time.
Outpatient?
Yes, ambulatory. So which that means is we do all the planning beforehand so that we know exactly how we're going to do the treatment. They come in on the day of the treatment. We make sure they're situated just right on the radiation device. We actually do imaging at the time of the treatment so that we essentially can see the tumor with the radiation device and then target the tumor. And essentially the treatments are anywhere from a few minutes to maybe half an hour. And then they essentially have, the treatment itself on that day really has no effects at all, and they go home.
No effects?
Yeah. Yeah.
So they go home and what?
And then they basically resume their normal life.
Side effects?
What side effects there are side effects of the tumor essentially reacting to the radiation. So occasionally the tumor might swell a little bit and that sort of thing, but generally patients do very, very well from this with no effects at all.
Doctor, what are the implications long term of what we're talking about?
I mean, we're talking about a totally, revolutionary type of cancer treatment that essentially is non-invasive but highly effective.
For you, but I'm curious about this. I asked you before we sat down to officially start the interview, when did you know that this was the field you wanted to go into?
I think the first time I interacted with a cancer patient is the first time I really kind of decided this is what I wanted to do, because the relationship you form as a doctor with a cancer patient is very different. I mean, it's a long-term relationship where you really are, helping the patient with the most basic needs, and you essentially see the patient all the way through.
Is it personal for you?
It is. It is.
It's personal for you.
It is. I mean, you can't help but make it personal when you deal with cancer patients and try to help them. It really is.
You don't buy the argument. It's interesting, without getting into an overly philosophical discussion. That's what Patch Adams, the real Patch Adams, because there wasn't just a movie. It's a real person, right?
Yes, yes.
And he said that to practice humanism in medicine, as our good friend Dr. Arnold Gold talked about, right?
Mm-hmm.
Who started the movement
Yes.
called humanism in medicine. He said you cannot take the empathy and compassion out of great clinical care. You believe
That's
that?
right. I definitely do. I mean, there's nothing more rewarding than having just a routine checkup with one of my cancer patients that I've treated and just see that basically they have a totally clean bill of health, and they're so happy and they just resume their normal lives and they have their families there, and there's nothing more rewarding than that.
Dr. Kevin Young, we are very proud and glad that you do what you do, and more importantly, your patients and their families are happy as well. Thank you so much.
Thanks for having me.
We appreciate it.
Thank you.
Stay with us one-on-one with fascinating people. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Investors Bank, New Jersey Natural Gas, Celgene Corporation, the law firm of Gibbons PC, New Jersey Sharing Network, Josh S. Weston, and by Choose New Jersey. Promotional support provided by The Star Ledger, powering NJ.com, and by Commerce Magazine. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.